Okay. Good afternoon and welcome to the Health and Government Operations Committee. Chairman Pendergrass chairs the committee. I'm Jocelyn Pena-Melnick. This is a virtual committee meeting, so I ask for your patience if we encounter any technological streaming issues. The bill hearing is being streamed on the Maryland General Assembly YouTube channel. Remember, even though we're meeting on Zoom, please adhere to our usual committee rules of 1 question, 1 answer for the panel, not 1 question and 1 answer for each individual panelist. Also, please keep your questions shorter than expected. The bill sponsor or designee is allotted 5 minutes to present the bill. And then if there are any other, some of these bills are sponsor only, some have maybe 1 witness, you get 2 minutes to present. Please conclude your remarks when you see the timer finish. Members, you must remain please with your video on the camera during the entirety of the bill hearing. We have the following bills today. We have Senate Bill 600, Senate Bill 230, Senate Bill 682, Senate Bill 62, 133, 103, 27, 527, 164, 173, 531, 440, 834, 853, 120, and 19, and the last bill, Senate Bill 355. Actually, Richard and Susanna will let you know in the chat room what bill we're on and which one is next. We're going to get started first with Senate Bill 600, Senator Kelly, Health Facilities, Residential Services Agencies Reporting Requirements. Good afternoon, Senator. Susanna, is she in? Yeah.
Yes, she just has to unmute.
Okay. Okay.
Senator Kelly, how are you?
Hi, how are you? Okay, well, I'm unmuted. Can you hear me?
Yes, Chairman, we can hear you.
I don't know what's happening with the camera.
It's okay.
Madam Chair and members, personal care aides, also called home care workers, provide care and support to older adults and to people with disabilities so they can stay in their homes and thrive. Personal care aides help with things like bathing, toileting, and eating. I'm sure that some of the members of this committee have relied on personal care aides to help loved ones. These workers not only provide care for the loved ones, they are often almost like family to the people they serve. 90% of them are women and about 60% of them are Black women. Most of these workers are paid with state money through Medicaid programs. Maryland is facing a home care workforce crisis. We simply do not have nearly enough personal care aides to meet our state's growing need, and our state is suffering needlessly as a result. Senate Bill 600 would help Maryland in 2 ways. But first, it would help us to solve our state's terrible shortage of home care workers by letting us know the 2 basic things we need to know about their jobs. How much are the workers being paid and what benefits are they receiving? Right now, despite the fact that the Maryland Department of Health funds most home care in Maryland by paying residential service agencies for every hour of care a worker provides for a Medicaid recipient, the department does nothing to learn how much these workers are paid or whether these workers are actually being paid in a timely manner. We need to know whether they're classified as employees or as independent contractors. Senate Bill 600 will get this critical information to policymakers so we can learn more about the workforce and make sure state policies allow for residential service agencies to make a profit, which they should, while ensuring that these jobs are good jobs paying decent wages. Now, second, as we all know, Congress has been talking about passing a reconciliation budget bill for much of the last year. There is one common thing in all of the different versions of that bill: hundreds of billions of dollars for state Medicaid home care programs. But the bill language requires states to report to the federal government information on personal care aides, wages, and benefits before the state can get the money. Now, Maryland will not be able to access the money, more than $1 billion in our case, unless we collect this information once they get the federal bill passed and signed into law. Senate Bill 600 will ensure that when the federal bill does pass, and is expected to pass within a few months, Maryland will be able to access the funds without delay. We can then use this money to increase payments for residential service agencies while also increasing pay for workers. Last year, this committee and the Senate unanimously voted for a favorable report of Senate Bill 384, a bill that included the same reporting provisions in the current bill. However, the 2021 version of this legislation passed by the House did not include the reporting provisions which the federal resolution now requires. Senate Bill 600 also addresses the concerns that some business owners raised last year by making clear that none of the information they report to the Department of Health will be made public. Rather, it will be used by the department to create a report on Medicaid reimbursement rates and related issues so that we can make sure that residential service agencies receive enough money to make a profit and workers make enough money to stay in the field. We are particularly concerned right now because we don't have nearly enough workers available to do the job. Right while I'm speaking to you, my husband, who's normally served, since he's had a stroke, by a residential care agency in our county, cannot be served. I'm really nervous right at the moment because the residential care aide assigned today just had a death in her family. I've been notified within the last few minutes. She's had to leave and the agency can't produce anybody else. My husband's on 13 medications a day. So it's important, real people, your constituents and mine, need the agencies to be solvent and their workers to be paid appropriately. So we need the information that we're asking for. And Senate Bill 600, in light of these considerations, I ask for your favorable report.
Thank you, Chairman Kelly, for your presentation today. And I hope your husband, is
I'm
doing
on pins
better.
and needles. I'm trying to find a backup.
I hope you find one. Are there any
Thank you.
questions for the chairman? Delegate Johnson.
Yeah.
Thank you, Madam Chairman,
My
and thank you,
pleasure.
Senator, for bringing this bill. Does this have a House cross file?
I don't believe it does.
Delegate Kaiser is saying yes.
Oh, then that's fine. That's even better.
Okay, that's what we like to hear, Senator. Thank you, Madam Chair.
It does.
Okay.
It's the cross file is House Bill 544.
Very good. Thank you.
Our pleasure. Any
Okay.
other questions for the chairman? Let's see. Okay, I don't see any other question, Chairman Kelly. So, and there are no other witnesses. So this
Well, thank
concludes the
you.
bill hearing on Senate Bill 600. Thank you for being with us today. Next, we have Senator Jackson, Senate Bill 230, Health Occupation Service Members, Veterans, and Military Spouses, Temporary Licensure, Certification, Registration, and Permitting. Senator Jackson, what can you tell us about Senate Bill 230?
Thank you, Madam Vice Chair, Madam Chair, and members of the Health and Government Operations Committee. For the record, Senator Michael Jackson, representing District 27, as well as in my capacity as the chair of the Senate Veterans Caucus. On behalf of Senate Bill 230, Senate Bill 230 is an identical cross-file to House Bill 112, which you heard earlier this session. Senate Bill 230 would create a process requiring each health occupation board to allow for experienced healthcare professionals who also happen to be service members, military spouses, and veterans to receive temporary licensure in multiple health occupations, provided these individuals meet a few criteria. The individual must provide proof that they are a service member, a veteran, or a military spouse, having been assigned to a duty station in the state of Maryland and established a legal residence here. The individual must provide proof that they have held a valid license or similar certification in another state for at least 1 year and is in good standing in said state. And finally, the individual must provide proof that they have applied for full licensure, certification, registration, or permit in Maryland and pay all required fees and submit to the required criminal history records checks. This legislation will be applicable in numerous fields and help fill needs in a variety of healthcare professions, including but not limited to audiology, dentistry, nursing, optometry, and some others. The aim of this legislation, Madam Chair, is to create a mutually beneficial situation for both the state and for military members and their families whose service brings them to Maryland. Often military members and their family members are forced to work at levels below their expertise because of a lack of certification relating to licensing issues brought about by the moves that their military service requires. Among other things, they can create unnecessary financial hardships with individuals while they wait for their licensure and certifications to be processed. And on the positive side, it offers more professional services to our citizens here in Maryland. With the need for healthcare professionals at a premium, it's imperative that we get qualified individuals to work as quickly as possible. I believe this legislation does just that and helps our military community at the same time. Madam Vice Chair, Madam Chair, and members, there's also an amendment in your packet that provides some clarifying language, including the striking of armed forces of the United States and its substitutes in the uniformed services under 10 U.S. Code, subsection 101. As amended in the Senate, the Education, Health, and Environmental Affairs Committee voted this bill out as amended 11-0. The full Senate voted it out 44-0. And with that, Madam Vice Chair, Madam Chair, and members of the committee, I ask for a favorable report, and I'll try to stand for questions. Thank you.
Thank you so much, Senator Jackson, for your work and for being with us today. Are there any questions for Senator Jackson? I don't see any questions, Senator Jackson. So, oh yes, Chairman Pendergrass.
Thank you, Madam Chair.
My pleasure.
Senator, can you tell me how this relates to our streamlined process for military veterans and families that now exist, how this interacts in any way or duplicates or anything?
Actually, what it does is apparently the Department of Defense asked us to put this particular bill in, and this actually helps to streamline it and I guess sort of codifies it. It also, within the bill, it asks for an explanation for any of the service members who may be caught in the system who have not been able to get their certifications processed and have not been able to join in the healthcare workforce.
Okay, I don't think that answered my question, but it may be that's not answerable. I don't know. It seems to me that we have a streamlined process, at least for some licenses. And if we have that, I'm not sure why that isn't adequate.
Well, again, Madam Chair, that came up in the Senate hearing, but the Department of Defense had a number of occasions where folks were still bottlenecked in the system, and that's why they brought it before us. So.
Thank you.
Any other questions for Senator Jackson? Let me just make sure. I see none. Thank you, Senator Jackson, for being with us today. And
thank you all. Have a great day.
Our pleasure. You too. This will conclude the bill hearing on Senate Bill 230. Next, we have Senate Bill 682, Senator Washington, Maryland Medical Assistance Program, Gender Affirming Treatment, Trans Health Equity Act of 2022. This is the cross-file of House Bill 746. Senator Washington.
Thank you so much. Good afternoon, Chair Pendergrass, Vice Chair Pena-Melnick, and all the members of the committee. Thank you for giving me the opportunity to for me to present my testimony on SB 682, which the Vice Chair has said is the cross-file of the bill sponsored by Delegate Kaiser and was heard on March 8th. As drafted, both bills seek to modernize our Medicaid program and to ensure that Maryland is in keeping with best practices for gender-affirming healthcare. As you know, currently Medicaid coverage of gender-affirming care in Maryland follows medical standards that were created over 20 years ago. And our coverage does not meet today's best practices, nor does it provide significant opportunities for taking advantage of advances in medical sciences that have occurred since the 90s. From the prior testimony, you learned that our Medicaid program categorically excludes dozens of gender-affirming procedures from coverage, regardless of the medical need or a doctor's prescription. This bill was created through several meetings, as you know, with the Maryland Department of Health, where the stakeholders and the providers work together to learn from each other and the department how best to provide sufficient medical care. SB 682 and HB 742 are the result of that work. Now, I just want to briefly discuss the amendments. Among the medical institutions that support this bill is MedChi. MedChi agreed that Medicaid must provide this care, and they identified a way to strengthen the bill. And they are represented in the amendments that were adopted in EHE and on the Senate floor. And you should have a copy of these amendments. Amendment number 1 adds sponsors. And then on line 5 of the bill, after the word provide, it inserts the words medically necessary. And in the same line, after the word treatment, it inserts in a non-discriminatory manner, requiring that gender-affirming treatment be assessed according to non-discriminatory criteria that are consistent with current medical standards. Again, the goal of this bill is to become consistent with current medical standards. Amendment number 2 on page 3 strikes all the references to specific procedures listed in the bill. This allows the law to keep pace with medical science and changes in medical science without having to change law. It also provides inclusive legislative intent regarding procedures, treatment, and coverage. As amended, SB 682 does a few things. It requires that Maryland's Medicaid program provide gender-affirming treatment in accordance with a newly created section 15-15. It defines gender-affirming treatment as medically necessary, 2, as prescribed by a licensed healthcare provider, and 3, treats a condition related to an individual's gender identity. Second, it requires Medicaid to cover gender-affirming treatment when it is medically necessary and according to the non-discriminatory standards that are highlighted in the amendment. Third, it prevents the denial of treatment under Medicaid based on gender identity and outdated standards of what is medically necessary, and also keeps one from being denied without the benefit of an experienced medical provider's opinion. And then finally, so that we can understand how this change is affecting the delivery of care, there will be a report that will help connect Medicaid enrollees with appropriate providers and data. So in closing, for far too long, our Medicaid program has been out of alignment with medical consensus and best practices regarding gender-affirming care. As amended, SB 682 ensures that our Medicaid program and our licensed healthcare providers are able to provide medically necessary care to all Marylanders, regardless of their gender identity. I thank you for your attention, and I ask you for a favorable report of SB 682 as amended, and I stand here for questions.
Thank you, Senator. Really appreciate your work on this issue and your testimony. We're going to open it up for questions now. And first we have Delegate Morgan, followed by Delegate Saab.
Hey,
Delegate Morgan.
Thank you, Madam Chair. Senator, hey, thank you for the bill.
Sure.
A couple of questions, because you went through those amendments very fast and
Sure.
you did a good job. You did a good job presenting the bill, and I just want to make sure I understand it.
Sure.
At one point you said medical necessity,
Mhm.
and then you later said a physician has to, I guess, sign off on this for a lack of or prescribe it. Can you elaborate on that a little bit more?
Right. So 2 things. We wanted to clarify that as defined, there are treatments that are considered medically necessary. So what has happened in the past is that a doctor or a healthcare provider will define a procedure, some of those listed, as medically necessary. However, based on its insurance standards, and other insurance companies do this as well, I'm sure you've seen that, they don't define it as medically necessary and as cosmetic, and therefore there would be some option to deny.
Okay,
So
I understand now. Yep.
okay. Okay.
So and you went through the Medicaid portion very, very quickly. I mean,
Okay.
so if a physician didn't accept Medicaid, there's nothing on the bill to force them to accept payment from Medicaid, correct?
No.
Do you know how many plastic surgeons that would do these types of surgeries do accept Medicaid funding?
I don't know.
Okay, thank you. Thank you, Madam Chair.
Sure.
My pleasure. Delegate Saab.
Thank you, Madam Chairman. Actually, my question, I heard medically necessary a bunch of times. So, I'm still struggling, trying to understand what the medically necessary is. And, I did a quick, I assumed I knew what it was, but I wanted to make sure. And the definition for pretty much everybody, including health insurance, is provided for diagnosis, treatment, cure, and relief of health condition, illness, injury, or disease, except for clinical trials.
Mm-hmm.
So when you say medically necessary, I understand this is cosmetically maybe necessary, at least the way I'm looking at it. And I know you took away some of the specifics in the name of science and changing, I guess, through medical processes. And you also mentioned consistently. So I guess the consistency, what you're talking about, is be consistent with health insurance, but I'm still struggling understanding that medically necessary, when you actually exclusively deleted some of those items that they were in the original bill, that it wasn't medically necessary. So can the doctor, from a liability perspective, say, well, this is not medically necessary, because each person at this point looks like they interpret what medically necessary different than other doctors. So you can touch on that.
Yeah, that's part of what the amendments do. Let me go back and define, what we say. When we say that something, again, is medically necessary, is prescribed by a licensed healthcare provider, and that treats a condition related to individual's gender identity. Specifically, the treatment is for gender dysphoria, which is defined by distress caused by the discrepancy between a person's body and their gender identity. And so in addition to some physical transformations that are currently covered under Medicaid, there are additional gender affirming procedures and treatment that are necessary to help an individual continue towards the path of having their gender identity confirmed with their outward expression. So what this bill does is clarifies that both that the treatment of gender dysphoria extends to gender affirming care.
Madam Chairman, if I can just follow up quickly,
Sure.
Delegate
Sure.
Morgan, question, and if you don't mind, Senator, if you can just maybe send it to the committee at a later date, how many plastic surgeons actually accept Medicaid? That would be great. Thank you.
I'm curious about this question. I'm not familiar with its relevance, so absolutely help me understand, because you've said it twice, and I'm assuming you're going to raise it on the floor. So I'd be interested to know, what does plastic surgeons have to do with providing gender affirming care?
So, well, I mean, that goes back to the bill. So the bill, so I guess, let me ask you a question then.
Sure.
So what's medically necessary? Does it involve any cosmetic or treatment in this bill, under this bill?
Right. It involves what has been previously defined as cosmetic. And so I'm sure you remember that, I believe it's last year, maybe it's this year, that we included dental care in Medicaid coverage. For a very long time, dental care or the replacement of teeth, et cetera, was just considered cosmetic. However, data and research, and experience show that there's comorbidities related to dental care. And therefore, dental care is not simply cosmetic, it's medically necessary to maintain the health of the individual. So similarly, there were procedures that 20 years ago just was simply considered cosmetic, whether it's electrolysis or it's some hormones related to adjusting the voice, all of that list. So this bill doesn't remove that. What this bill just says is rather than going through this list, it just says if it's medically necessary, and it removes this outdated idea that gender affirming treatment is cosmetic.
Well, but it's subject to the interpretation of the doctor too, because the medical necessary term is a broad term. But I don't want to hold up the committee. I'm sure you and I can have a conversation.
Yeah, I'm
offline,
happy
but
to
thank you.
educate you on current standards.
Thank you, Senator. I just for clarification for my purposes,
Yeah.
this bill simply requires Medicaid beginning January 1st, 2023 to provide coverage for
Thanks.
gender affirming treatment, correct?
Correct.
Delegate Kaiser, can you mute, please? Thank you. Basically for gender affirming treatment, correct?
That's it.
Gender affirming treatment is a condition that is diagnosed by a professional doctor, correct?
That is correct.
Just like you will be diagnosed for cancer, correct? Or any other illness, right? It is a condition accepted by the medical community, right?
Yes, it is in DSM-5,
And
most
then-
recently published in 2013. Yes.
And basically, the treatment, just like cancer, can be many different treatments according to that individual, correct?
Absolutely.
So-
And yes,
So the bill is not prescriptive anymore because it's best to leave it blank because things keep changing, right?
that is correct.
All right, thank you. We have Delegate Kaiser, followed by Delegate Robin Lewis.
Thank you, Madam Chair. My question for Senator Washington, pretty easy. Just want to make sure the committee knows, what was the nature of the debate in the Senate on second and third reader?
There was really no debate.
Okay, thank you.
Thank you. Delegate Lewis.
Thank you, Madam Chair, and thank you, Delegate Washington, for bringing the Senate version of the bill. My question also is about plastic surgery. And I'd like to know if the bill that passed the Senate includes any direction regarding surgical alterations, or in fact, was that stricken from the text?
So again, any specific procedures were stricken. So again, as the Vice Chair noted, that the decision about how to affirm one's gender really should be between the patient and their healthcare provider.
And if I may, Madam Chair, then the healthcare providers who offer gender affirming care come from all different disciplines, not
Absolutely.
just plastic surgery. Is that correct? So it could be a family practitioner. Senator, is that an option?
Absolutely. And thank you for that. My question was somewhat rhetorical when I was asking why the focus on plastic surgeons.
Thank you so much, Senator, Madam Chair.
Pleasure. And then we have Delegate Chisholm.
Thank you, Madam Chair, and thank you,
My
Senator,
pleasure.
for bringing the bill. Just for clarification, I know you said there was no debate, but what was the vote in committee and what was the vote on the floor? Of the
Yeah, as with many of our bills, it was split. I believe we were 15 to 32.
Okay, so along party
31.
lines.
Sorry, 31. You're right, 31.
Okay, we just didn't debate. They just didn't debate it. They just didn't agree. I got you. Okay.
Yeah,
thank
yeah.
you.
I mean, and again, that happens at times. You don't disagree. You may disagree for a policy reason. So you just vote against it and move on. There's other bills that we have more extended debate, but this was not one of them.
Thank you. I just wanted to understand, because you said there was no debate. It was confusing to me, but I'm glad you clarified that.
No problem.
Thank you, Senator. Thank you,
And
Madam Chair.
My pleasure, Delegate. And Senator, are you aware, and I was looking for it, I don't see it in your file, but I know we have it. There was a letter sent this past week by the association that represents all the plastic surgeons. There are like thousands and thousands and thousands of them that said that they support this bill and that they do this work. I know
Absolutely.
we have it in the file.
Yes.
Thank you.
Mess.
Wonderful.
There's rarely this level of consensus, as you know, through EHE and at HGO, but it is just, there is a tremendous amount of consensus that this bill will save lives, and that it's important that that we are able to provide the full range of gender affirming care, and that's what this bill does.
Thank you. Any other question for the senator? And I appreciate all the questions
So,
and
absolutely.
clarification from our members. They're always welcome.
No,
Anyone
it's
else?
good. It's good.
No, I see no other questions regarding this bill, Senator. So this will conclude the bill hearing on Senate Bill 682. And our wonderful delegate, Chairman Kelly is back. There you go. It's all yours.
Thank you so much. Thank
My
you for
pleasure.
filling in for me, Madam Vice Chair, as I was across the street in the Senate. We're going to continue with Senator Washington's bills. So we have now Senate Bill 62, Pharmacists Aid for the Cessation of Tobacco Product Use. Senator Washington.
Thank you. Thank you, Madam Chair. Once again, for the record, Senator Mary Washington, and I'm honored to have the opportunity to testify in support of SB 662, Aid for Cessation of Tobacco Products. And I'm also happy to say that SB 62 did in fact pass unanimously on the Senate floor and in committee. And it is the cross file of HB 28 that was sponsored by Delegates Bandari and Robin Lewis. As you know, of course, it passed unanimously on the House floor on Monday. So I simply would like to just remind those who are watching that the SB 62 is an important step towards expanding access to care for Marylanders who continue to engage our pharmacists in our efforts to improve the health of our communities. Certainly, the COVID-19 pandemic has made more urgent the need for collaboration and teamwork and the delivering of life-saving medications and vaccines. Maryland spends about $2.7 billion annually to manage the healthcare costs of smokers. So each year we are spending billions of dollars treating individuals for preventable diseases related to smoking. And we can decrease this annual expenditure and invest that in other expenditures if we could get more smoking cessation aids into the hands of smokers. So as you know, SB 62 would grant nicotine replacement therapy, prescribing, and dispensing rights to qualifying pharmacists. I've seen that there are House amendments. We've reviewed those and believe that they would be considered friendly amendments, as I know the subcommittee and advocates in MedChi have worked these out. And I understand that MedChi was originally opposed to the bill, so this is good. It brings everybody into together. So I ask for your favorable report and ask you to conform this bill to HB 28.
Thank you so much. Any questions for Senator Washington on Senate Bill 62? I don't see any questions. Giving you guys just a second. Let's move right along to Senator Washington's Senate Bill 133, State Board of Certification of Residential Child Care Program Professionals Membership and Official Seal.
Yes, and my bills just keep getting more and more controversial. Thank you for the opportunity to present SB 133, which is the Senate cross file of HB 21, which is sponsored by Delegate Collison, and it also passed on third reader out of the House. HB 21 did. As drafted, SB 133 will change the number of members on the State Board of the Certification of Residential Child Care Program Professionals from 12 to 11. This change will allow the board to have an odd number of voting members, thereby making it easier to achieve some majority votes on really significant legislative and administrative matters that impact the quality of services that are provided to the youth in our state. It also removes the potential state agencies' conflict of interest in those deliberations. It also removes a requirement for the board to design a logo. And as you know, there was no opposition to the bill in either the House or the Senate hearing. There is one committee amendment or Senate amendment. We repealed the requirement that a member of the board be a United States citizen. We found it not necessary, and there are many providers that are not citizens. There was no opposition to that amendment in the committee or the floor. I'll say that again. There was no opposition to that amendment in the committee or the floor. I ask for your favorable report of SB 133 as amended.
Thank you very much, Senator Washington. Any questions on SB 133 for the senator? I don't see any hands up, so I think you have concluded your work before our committee today. Thank you so much, Senator Washington, and we look forward to working with you.
Thank you all so much. Have a good day.
Do we have Senator Augustine? I do see Senator Augustine is here. Wonderful. So we have two bills now from Senator Augustine. I will remind you, Senator Augustine, you'll have a 5-minute clock running. You do not need to use all of that time, particularly if you have an identical cross-file. So Senate Bill 103, State Board of Examiners for Audiologists, Hearing Aid Dispensers, Speech Language Pathologists, and Music Therapists revisions. Welcome, Senator Augustine.
Thank you, Chair Kelly. Senate Bill 103 is an identical cross-file to House Bill 155, so I would just ask for a favorable report. Thank you.
Excellent testimony. Any questions for the senator? I do not see any hands up, so that concludes the hearing on SB 103, and we'll move on to SB 27, Alzheimer's Disease and Dementia Council and Coordination of Services, Dementia Services Act of 2022. Go ahead.
Okay, thank you, Chair Kelly. Senate Bill 27 is a cross-file with House Bill 166. We had a drafting error on our side, our fault. On page 6 of the reprint, the director shall. There was some additional language that the House bill had in there, including through public awareness, prevention, and early detection and diagnosis. It was supposed to be there on our bill. It wasn't. So, hopefully we can get that squared away. There was also a separate difference between the two bills in that on the House bill, there was a mandatory appropriation that was put in. We did not put that in on the Senate side because that would have required us going to budget and tax, and the amount of money that was discussed in this per year, 71,000. We just felt like it was not that we're not concerned to take this to budget and tax and create the mandated appropriation. And I just asked for a favorable report from the committee.
Thank you very much, Senator Augustine. Do we have any questions on this bill for the senator? I see no hands up, so that concludes the hearing on Senate Bill 27. Thank you so much. Now we have, thank you very much. We have 3 bills from Senator Feldman. I believe there's someone from Senator Feldman's office here. Senate Bill 527 is the first one, Elderly Individuals, Howard County and Montgomery County Adult Day Healthcare Services Pilot Program and Task Force. Is the senator here, or do we have a representative?
Yes. Hi, sorry, Senator Feldman, I can't be here. Good afternoon, Chair Pendergrass, Vice Chair Pena-Melnick, and honorable members of the Health and Government Operations Committee. My name is Andrew Sondry. I'm Senator Feldman's legislative aide. I'm here on his behalf today. Unfortunately, he couldn't be here. He sends his sincerest apologies. He is in the Finance Committee right now. I am here to present Senate Bill 527, which, as you heard, is the Howard County and Montgomery County Adult Day Healthcare Services Pilot Program and Task Force. It's a cross-file of House Bill 1051, sponsored by Delegate Kelly, and it does, as the name suggests, it establishes an Adult Day Healthcare Services Pilot Program and Task Force in Montgomery and Howard counties. It passed unanimously through the Senate Finance Committee and through the full Maryland Senate. And the House cross-file 1051 passed unanimously out of this committee and unanimously through the House. Senator Feldman asks for a favorable report.
So much. Do we have any questions from the committee? Seeing none, that concludes the hearing on Senate Bill 527, and we will move on to Senate Bill 164, also Senator Feldman, insurance, annuities, non-forfeiture interest rate. Go right ahead.
Excellent. Thank you so much, Madam Chair. So Senate Bill 164 is the next bill that I'm here to present on behalf of Senator Feldman. This bill alters the minimum interest rate in the determination of minimum non-forfeiture amounts for annuity contracts. It's a cross-file of House Bill 119, sponsored by Delegate Chi. It passed unanimously through the Senate Finance Committee and unanimously out of the Senate. It also passed the House cross-file passed unanimously out of this committee and overwhelmingly through the House of Delegates. Senator Feldman asks for a favorable report.
Excellent. Any questions on this bill from the committee? Seeing no questions, that concludes the hearing on Senate Bill 173. Let's move on to, yes, we have one more from Senator Feldman. Nope, we're done with Senator Feldman. I apologize. Thank you so much. Make sure to report back that you did a great job. We are going to move on to Senator Bidel, I believe. Do we have someone here?
Sorry,
Yes.
we skipped a bill. That was one.
Skipped a bill. Oh, that's what happened. I ended the hearing on 173 and I should have ended it on 164. My apologies. Do we still have someone here from Senator Feldman's office? I hope he didn't.
I'm still here.
Thank you for bearing with me. I apologize. So we still need to hear 173. We've concluded the hearing on 164. Senate Bill 173, Health Insurance Nonprofit Health Service Plan Board of Directors. Go right ahead.
Excellent. Thank you so much, Madam Chair. Again, for the record, my name is Andrew Sondra. I'm here on behalf of Senator Feldman. I am here to present Senate Bill 173, Health Insurance Nonprofit Health Service Plan Board of Directors. It's a cross-file of House Bill 106, sponsored by Delegate Cullison. It alters the composition of a nonprofit health service plan board of directors. Again, this one passed unanimously through the Senate Finance Committee and through the full Senate, and the House version of this bill passed unanimously through this committee and overwhelmingly in the House. Senator Feldman asks for a favorable report.
Excellent. Thank you so much. Any questions from the committee on this bill? I see no hands up. So that concludes the hearing on Senate Bill 173. Thank you so much.
Thank you, Madam Chair.
Do we have Senator Bidel here?
Not yet. She was contacted.
Okay. Let's see. After Senator Bidel, we have a couple from Senator Lamb, who I'm going to assume is not here yet either, correct?
Correct.
Do we have any identical cross files from the committee that we could maybe consider? I could do, let's see. That's not identical. Is Delegate Lewis Young here? She could possibly do Senate Bill 19 for Senator Lamb.
I am.
You could handle that for us while we wait for Senator Bidel.
I can. Right now, the two bills are not in identical posture. You may recall that in the House version, we accepted an amendment from the insurance carriers. However, Senator Lamb did agree to accept those amendments after his bill passed. So that shouldn't be a problem.
Excellent. We have a question from Delegate Johnson.
Thank you, Madam Chairman. Which one of Senator Lamb's bills are we talking about right now?
We're talking about Senate Bill 19, Pharmacist Administration of Maintenance Injectable Medications. Sorry. Thank you for asking the clarifying question. That was my bad.
Thank you, Madam Chairman.
Mine too.
And now we have Senator Bidel here. Thank you for rushing to us, Senator Bidel. We're here to hear two of your bills, Senate Bill 531 and then Senate Bill 440, and Senate Bill 834. Let's start with 531, Maryland Healthcare Commission Assisted Living Programs Study. And I will just remind you, if you have identical or nearly identical cross-file, you certainly don't need to take the whole 5 minutes on the clock. I know you know that, but just wanted to note it.
Madam Chair Kelly, thank you very much for allowing me to present Senate Bill 531. Good afternoon, members. And Senate Bill 531 isn't exactly the same posture as the House Bill 636, and and they passed the Senate unanimously. How's that?
Perfect testimony. Any questions for Senator Beidle on this bill? Delegate Johnson, your hand is still up. Is that from the last bill?
Sorry, Madam Chairman, pilot error.
Okay, perfect. Let's move on to the next bill. Oh, let's conclude the hearing on Senate Bill 531 and move on to Senate Bill 440, Commission to Study the Healthcare Workforce Crisis in Maryland. Go ahead, Senator Beidle.
Thank you, Madam Chair. And I believe this is a bill that you and I cross-filed, and we were asked to put some amendments on from the Health Department that I do not think you got on your bill. So Senate Bill 440 is the cross-file 625, and the bills are not in the same posture. We made it an emergency bill at the request, and then expanded, I think, added 2 members to the commission. So I ask that you review Senate Bill 440 and either make it in the same posture or send amendments back to me and I'll make it in the same posture. But thank you, Madam Chair.
No, thank you very much. See if there's any questions from the committee. While I give you a second to raise your hands, I will just let Senator Beidle know that the subcommittee is going to be working out these details. It's important that we get it right. And I think many of the Senate amendments are things that we do want to accept. Delegate Hill.
I think, Madam Chair, that you may have explained it. I was because what Senator Beidle said is either make one match the other. And I just wanted to know whether we're fixing the Senate bill to match what we sent out of the House or taking the House bill and asking them to amend it in the Senate. And it sounds like you're saying a little bit of both.
Well, we will have the Senate bill in subcommittee next week. Most of the Senate amendments, I think, make sense to the subcommittee, and we want to add. There is one amendment related to veterans that I'm not sure the Senate has that they also may need to add. So we will do this in as timely a way as possible, but make sure we get all of the scope of the study that we wanted included. Does that answer your question?
Yeah, it sounds like both bills are being amended simultaneously. Thank you.
Exactly.
Okay. I needed to make my notes appropriately.
Madam Chair, we did add Department of Veterans Affairs, by the way, but please, whatever is your pleasure to make them identical, I'll be happy.
Oh, you know what I think is missing, and we can take this offline, but I think it's the medical practitioners who are born in other countries language that I think the Senate bill doesn't have, but we'll figure it out and we will work together to make sure this happens. Thank you.
Thank you. Thank you.
Any further questions from the committee? Seeing none, that concludes the hearing on Senate Bill 440. And we will move on to Senate Bill 834, health insurance, two-sided incentive arrangements and capitated payments authorization. Senator Beidle.
Thank you. Thank you again, Madam Chair Kelly, and thank you to the members. We did work very closely with Health and Government on this bill with your delegate Cullison, the chair of the subcommittee, and both bills are in the identical posture and it passed the Senate unanimously.
Excellent testimony. Any questions from the committee on this bill? Seeing none, that concludes the hearing on Senate Bill 834.
Madam Chair,
yes.
could I just have her repeat the vote on that bill on the floor in the Senate?
It was unanimous.
Unanimous in the Senate. Thank you so much.
And it was unanimous in the House also, Delegate Pendergast, so thank you.
Okay, thank you.
Well done. Let's move on to Senator Lamb, who I understand is with us now. We have a couple bills from Senator Lamb, and he is our last senator for the day. So Senator Lamb, we have you for 4 bills. We'll start with Senate Bill 353, health insurance, prescription insulin drugs, limits on copayment and coinsurance. And I will remind you, Senator Lamb, as I've reminded the others, if you have an identical cross-file, you certainly don't need to use the whole 5 minutes on your clock. Thanks so much.
Sure. Sounds good. So thank you, Chair and members of the committee. I'm representing District 12. Senate Bill 353 is to limit the total amount of cost share for prescription insulin for individuals with eligible health insurance plans no more than $30 for a 30-day supply. That's regardless of the type or amount of insulin that's prescribed. Diabetes, as many of you are aware, is the largest and fastest growing chronic disease in the country. Here in Maryland, 500,000 people, or over 10% of adults here in the state, are living with diabetes, and nearly a third of them have pre-diabetes. Insulin is actually a very inexpensive drug. It costs less than $10 a vial to make. However, many Marylanders are paying quite a bit for their insulin. The Healthcare Commission had found that over the last a few years when they reviewed 2017 to 19 that Marylanders were paying $230 a month or almost $2,800 a year just on insulin itself. And this oftentimes impacts our more impoverished individuals more as well. Diabetes affects individuals from lower socioeconomic backgrounds at a higher rate than all other residents, with the prevalence of diabetes amongst these residents who are making less than $25,000 a year at 16.5% compared to 10%. So there's already a current state cap at $150 on insulin. We're not the first state to do this. Virginia has set it at $30. Texas has actually set it at $15. And so encourage a favorable vote out of this committee, and happy to answer any questions on this. Thank you.
Excellent. Any questions from the committee on this legislation? I don't see any hands up. Giving you one more second. Perfect. So that concludes the hearing on Senate Bill 353. And we will move on to Senate Bill 120, acupuncture licensure requirements.
All right. Thank you, Madam Chair, members of the committee, Clarence Lamb, Senator District 12. The purpose of Senate Bill 120 is to amend our current acupuncture licensing process so that these professionals must not only receive a diploma in an accredited program, also pass a nationally standardized certification exam in order to become licensed in our state. The bill was heard before this committee, and the current version that's before you is conformed to the House cross-file. In our current statute, acupuncturists in the state can obtain a license through a pathway accredited by the National Certification Commission on Acupuncture and Oriental Medicine, known as the NACOM. And so it's a national standard bearer in acupuncture, also has accrediting education programs and certifies acupuncturists. This bill modifies the language to require that all licensure applicants sit for the exam as well as acquire a diploma from an accredited program. Without this change, acupuncturists are the only licensed healthcare professionals in the state that aren't required to sit for a national certification exam. And Maryland is actually just one of 2 states in the entire country that does not have a license requirement for these folks to sit for a nationally certified certification exam, us in California. So passing this bill would help align our state's licensure requirements with the vast majority of other states. And with that, let me wrap and happy to answer any questions.
Thank you so much. Do we have any questions for the senator on this bill? Seeing no questions, that concludes the hearing on Senate Bill 120. Now, Senator Lamb, we already did hear briefly from Delegate Lewis Young on Senate Bill 19. So we can definitely hear from you as well, but I would just let you know she informed us that there is a House amendment that I believe you are open to. So if you could address that in your testimony. It is Senate Bill 19, Pharmacists Administration of Maintenance Injectable Medications, Treatment of Sexually Transmitted Infections.
Yes, thank you, Madam Chair. You've already heard from Delegate Lewis Young, who's the House cross-file of this. And the only thing I'll add is that, the members of this committee may remember last year that there was a bill, I think from also Delegate Lewis Young, to help allow pharmacists to administer maintenance injectable medications. We had heard from pharmacists as well last year that the pharmacists would like to also have the ability to administer antibiotics for STIs or sexually transmitted infections. And so this was added on last year, but unfortunately it did not make it through the full process. We were recommended to bring this back before the committee for a full bill itself. So this is now a standalone bill. So just to kind of jog members' memories. And so we are open to the amendment that the chair had suggested, and we'll wrap there. Happy to take any questions. I want to thank the committee staff who are really instrumental in helping us with the negotiations and also the amendment language on the bill. Thank you.
Excellent. Thank you so much. Any questions from the committee on this legislation? I don't see any hands up. So that will conclude the hearing on Senate Bill 19, and we will move on to the last hearing of the day, which does have a witness as well as Senator Lamb. So let's hear an introduction from Senator Lamb, and then we'll hear from Scott Tiffin. This is Senate Bill 355, HIV prevention drugs, prescribing and dispensing by pharmacists and insurance requirements.
All right, thank you, Madam Chair. This bill does not have a cross file, so it'll be a little bit more lengthy on this one. Senate Bill 355 is a new version of the bill that we had introduced in the last session, which would allow pharmacists to dispense full courses of pre-exposure prophylaxis known as PrEP, pre-exposure, and post-exposure prophylaxis, or PEP. And this really addresses some of the important insurance components that allow the dispensing of these medications without a prescription, without prior authorization, without step therapy, and without cost share. The bill blocks cost sharing for any ancillary services as well required for PrEP, which includes labs, blood work, and testing. The bill passed unanimously out of the Education, Health, and Environmental Affairs Committee, as well as the Finance Committee, where it was duly assigned, and the Senate chamber without a single unfavorable vote. Unfortunately, despite the unanimous vote in the Senate, we have not been able to achieve full consensus with the healthcare stakeholders regarding the implementation of this bill's authorizations at pharmacies. Thus, we are taking a proactive approach to address the concerns that have been brought up by the opponents by offering an amendment, which the committee has, that will strike the majority of the language except for the insurance provisions. We are retaining those provisions in order to reduce the barriers that stem from prior authorization, including costs to patients that need these drugs. For a bit of background, despite the success of antivirals in preventing the spread of HIV is still a major issue here in the state. In 2020 alone, there were over 30,000 people living with diagnosed HIV, and 724 newly diagnosed individuals occurred that year as well. In 2019, Maryland was ranked 8th among states in the rate of new HIV diagnoses, and the CDC estimates that there are over 3,800 people in the state who are living with HIV but are undiagnosed. Unfortunately, the medications that are in this bill are very effective in preventing the transmission of HIV. Pre-exposure prophylaxis, or PrEP, is taken as a daily pill, and according to the CDC, PrEP can reduce the risk of HIV transmission by as much as 99%. And post-exposure prophylaxis, or PEP, is also a daily oral medication regimen that, if begun within 72 hours of exposure to HIV, can reduce infection by around 80%, and a full course of PEP takes about 28 days. The bill, as amended, would lower financial hurdles to HIV treatment. The U.S. Preventive Services Task Force has issued a grade A recommendation for PrEP, which means that insurance plans cover PrEP without cost sharing. However, insurers are not being required to cover the costs of the ancillary services that are needed to take PrEP, nor do they cover PEP at no cost share. This creates a barrier to access where patients can afford to get PrEP drugs, but cannot afford the associated care that's required to take them. While there's some progress, whereas there are some state programs to help defray the cost of these medications, it is insufficient to defray the entire cost that may be associated with some of the ancillary services that are required. It's also important to note that the communities that take these medications are by definition an immediate risk to contracting HIV. So even delays of 24 to 72 hours, such as prior authorization, can create unnecessary barriers to their care. Reducing barriers of cost and insurance will not only increase the access to these life-saving medications, but also produce savings for our state Medicaid program in the long run, because the average lifetime cost for HIV treatment is in the tens of thousands of dollars. This bill makes both public health and good financial sense, and for these reasons, I urge a favorable report. I'd be happy to take any questions.
Senator Lamb, and before we go to questions for the senator, let's hear from Scott Tiffin. Scott, are you here?
Yep, I'm here.
Excellent. Go right ahead.
Thank you, Madam Chair and members of the committee. My name is Scott Tiffin, and I'm here on behalf of the American Academy of Nurse Midwives, the Maryland affiliate, as well as the Maryland Nurses Association and Healthcare for the Homeless. We are all in very strong support of this bill in order to prevent the spread of HIV in Maryland. As Senator Lamb mentioned, the provisions regarding pharmacy prescription have been removed, but the insurance provisions of this bill are truly going to be life-saving and life-changing for many, many Marylanders. The committee has already worked on legislation related to PEP, so I'm sure you're aware of how time-sensitive PEP is, but I really just wanted to highlight that PrEP is also extremely time-sensitive. As was already talked about, people who need PEP are at very, very high risk of contracting HIV, and any delay of access and treatment may result in them contracting HIV. And this is why the new CDC PrEP guidelines actually include protocols for providers on how to do same-day PrEP dispensing and how to counsel their patients and do all that work in one day just to make sure that they can get their patient on PrEP as soon as possible. Many patients who need PrEP, especially the folks Healthcare for the Homeless works with, are very marginalized by our healthcare system. And for a lot of these patients, things like prior auth that most of us just see as slight annoyances can really be insurmountable barriers for them accessing timely care. The insurance companies are correct that the clinical indications for the two different PrEP drugs are slightly different, but we feel that our providers in Maryland are more than capable of differentiating the clinical indications and prescribing the appropriate PrEP drug. Finally, I just wanted to note that in Kaiser's written testimony, they talk about using state funds to offset cost sharing costs. Last year, I actually spoke to MDH about this question, and they said that the special fund that Kaiser points out legally could be used for that purpose, but it has never had nearly enough money to even get close to doing that. So it's really just not a practical way to solve this problem. Overall, we just asked for a favorable report, and I'm happy to answer any questions.
Thank you very much. We have two questions at this point. First is Delegate Lewis, then we'll hear from Delegate Hill. Go ahead, Delegate Lewis.
Thank you, Madam Chair, and thank you to the good Dr. Delegate for bringing this important bill. I want to make sure I understand how the bill works, Senator Lamb. As somebody who's worked on international clinical trials that contributed to the establishment of PrEP as a product and a treatment, I'm really interested in this. Looking at the bill, the version of the bill that I have access to is the original version. So you mentioned that all of the provisions related to pharmacists have been stricken, and the only thing that remains is the requirement that no copay can be imposed, and that prior auth for these life-saving drugs is not required. That's what the bill does?
Yes, that's correct. That's what the bill does. There should be an amendment in your packet, and if not, we can get that.
It might be my
to you,
fault
certainly.
for not being able to see it. But
No,
just,
no worries.
But just to make sure, it's a simple and straightforward and life-saving bill. So that helps.
And it actually just focuses on the prior authorization part, because I think because it is grade A by the U.S. Preventive Services Task Force, it is already required to be provided with no cost share to individuals. So by federal regs, it's already no cost share to individuals. This would eliminate prior authorization and also require that ancillary services be covered too. So that's the other important piece of this, because it's not just the medication itself. They may need some follow-up testing or testing before they get the medication, rather, and it would require that the ancillary testing also be covered. So the drug itself is covered by federal regs, but some of these ancillary services are not.
Thank you so much.
That's what this bill would help address too.
Thank you, Senator. Thank you, Madam Chair.
Absolutely. Next is Delegate Hill.
Thank you. And thank you, Senator Lamb, my Senator, District 12. I'm still a little confused. So I'm looking at the third reader. And I'm confused about whether you're saying there are additional amendments to the bill as it left the Senate, or the bill as it left the Senate has brought people aboard. You mentioned that there's still some disagreement. I'm just real succinct. What is the bill that you want us to pass?
Yeah, so that's a good question. The bill that is coming over, we are offering to amend to take out sections 12-101, 12-15 or 514, and it will retain 15-103, and then kind of go forward with a few lines added in. So it's really striking the provisions that allow pharmacies to actually dispense PrEP itself, and focusing more on reducing the barriers to access and some of the costs that pertain to ancillary services. So, pharmacists in the version as proposed with these amendments would not be able to dispense on their own, but those patients who need this would not require prior authorization if this were passed, nor would they be required to incur any cost sharing from any of the ancillary tests that come as part of the PrEP treatment. I think you're muted.
It was a thank you. Thank you.
Excellent. Let's hear next from Delegate Johnson and then the subcommittee chair Cullison. Delegate Johnson.
Thank you, Madam Chairman, and thank you, Senator, for this bill. My question is, Senator, since we don't have a House crossfile, would it be advantageous, since the time sensitivity of this medication, to make this an emergency bill?
We would not be opposed to making an emergency bill. Obviously, the bar is higher for passage, but I think we recognize that there is some urgency to the timing of this. I mean, folks have been able to have access to PrEP for quite a few years already, and then it's been grade A from the U.S. Preventive Services Task Force for that time as well. And since the Affordable Care Act was passed, all grade A recommendations from the Preventive Services Task Force already have to be covered. And so we are in some ways behind the ball in making sure that people have full access to this. So, had no opposition to making this an emergency bill.
I don't want to throw any obstacles. I just want to get your take on that. Thank you. Thank you, Madam Chairman.
Absolutely. Finally, Delegate Cullison.
Oh, thank you, Madam Chair. And thank you, Senator, for bringing this to our attention. So I have a question around the urgency. My understanding is, and I don't pretend to understand it all, but that a person would need to be HIV positive, negative before they could receive either of these drugs or any of the drugs that are in PrEP. And my assumption is, but help me if I'm wrong, that there would be the discussion with the physician would be, I'm engaging in activities that put me at risk. So I am interested in PrEP, or the physician might likely say, I would like you to consider PrEP. So there would have to be a test for HIV, which you alluded to in terms of not being covered, those ancillary services. I'm assuming that takes at least 24 hours. And if I'm wrong, let me know, which is probably about the same amount of time as the pre-authorization. So how are we saving time by eliminating the pre-authorization when this other event has to happen? Understanding, I understand the concerns around pre-auths, but I have to wear my insurance hat DCAT to say, formularies have a purpose and in our insurance world as it stands. And so I worry how this might affect formulary kinds of things if we, considerations if we were to take this pre-auth around this particular drug away. So I think there's probably a lot in there, Senator.
Sure. Yeah, I can start. So let me say as a baseline, and HIV testing has actually advanced quite a bit these days. I think all of us are familiar with rapid tests for COVID, just given everything that we've been through. There are actually rapid tests available for HIV as well. So, you can even just go to CVS. I'm seeing now, just Googling it quickly, there's like a 4th generation CVS HIV at-home test that you can get for $70. These tests are very quick. It's just a quick finger prick, and then you usually have your results in 15, 30 minutes. And so it's a very quick turnaround to be able to determine whether or not someone is appropriate to receive PrEP or not. Having the prior authorization would in all likelihood take longer than 30 minutes, although that would be great. But, it would really delay and present another barrier of access to these folks. I think earlier we had also spoken about where these folks may get it. Sometimes they may get it at a primary care provider, in which case they may have to go to a pharmacy down the street to be able to get the medication. At other times, and in doing a little bit more research, there are some federally qualified health centers, so FQHCs, that may have the drugs on hand immediately. And so in these instances, particularly for these populations that are harder to reach, that may have already barriers to be able to access adequate care, they may be able to get the medication right away as a one-stop shop. were it not for these prior authorizations, any delays that would be imposed for them to be able to walk out of the clinic with the medication themselves. So they may be able to talk to the provider, go down the hallway, get their finger prick, and then have a test result back within a few minutes, and then also walk out the door with PrEP in hand. And we know that, when folks are engaging behavior that may incur risk, any delay in being able to get them preventive care or preventive medications does increase the risk that they could engage that behavior without waiting for the preventive medication. And so that's why CDC has actually recommended that there be on-demand PrEP for these individuals. So if you look at the CDC's recommendation, they do recommend on-demand PrEP, which means taking 2 pills of PrEP anywhere from 2 to 24 hours before engaging in some type of sexual behavior, and then having access to it immediately afterwards as well. But that beforehand dosage is really important, and this is what is meant to be addressed by the bill.
Okay. All right, thank you. We'll discuss this further in subcommittee next week, on Tuesday. So thank you very much.
Sure.
Seeing no more questions from the committee, that concludes the hearing on Senate Bill 355. Thank you so much, Senator Lamb. That was the last bill of the day, so we are going to conclude our hearings for the day, and I believe the committee has a voting session on Friday. I'm looking for a nod tomorrow at 1 o'clock. Excellent. Thank you.